Hello everybody, welcome to the Thursday edition of Video Clips, and I want to talk a little bit about the cases. I've mentioned a couple times this week already, we don't know how many cases there are and how many deaths there are, and so I'm going to give you some news here that will really illustrate my point. NBC considers Dr. Joseph Fair to be, quote, today's most knowledgeable expert on the coronavirus outbreak. Okay, so Dr. Fair reports that he was recently diagnosed with COVID-19 and tweeted that he ended up in the hospital as a result. So here is what the most knowledgeable person, expert on the coronavirus, reports. He flew home from New York City to New Orleans wearing a mask and gloves and wiped everything down so he thinks he contracted it through his eyes. And when I read that, I thought, well, you know what the next thing they're going to suggest is? Everybody wears a blindfold over their eyes and walks with a cane, because that's a way of transmitting it. We have to do everything we can. So even if you go to the grocery store, you're going to have to learn to read Braille, you're going to have to walk with a cane, cover your eyes. All right, that's my rant. But then he reports that his symptoms were not classic symptoms, but that nothing really is. The disease is so variable that almost any symptom can be called COVID. So he developed shortness of breath, finally decided he needed to call an ambulance, and was admitted to Tulane Medical Center. He had 4 COVID tests and they were all negative, but he knows he has it, and his doctors confirmed that this was the case. So you have 4 tests that are negative, but you know you have it, so don't let the test results get in your way, for crying out loud. So what do we take from this? Well, anybody determined to have COVID will have it. The testing doesn't matter, nor does wearing the masks and the gloves and wiping things down. And by the way, you know, this guy's a medical expert, and people wonder why I saw it on the news, and you're telling me the news is wrong? And I'm thinking, well, what planet do you live on, first of all? But yeah, the news is wrong. This guy's an expert. He's getting on TV every day or often and talking about this issue a lot. And he tests negative 4 times, but he's really sure he's got it. Now, interestingly enough, I came across this article online, and right about the same time, I subscribed to all these medical feeds, and I get this article from Medscape, and it's titled COVID-19 Test Results Don't Discount Clinical Intuition. So the article starts by describing a patient who arrived at UC San Diego Medical Center with classic COVID symptoms, history of coughs and pneumonia, severe respiratory distress, and required immediate intubation. So they took swabs from the back of the throat 2 times, and the person tested negative. And then, you got to hear this, quote, the 2 negative tests didn't convince anybody, said Davy Smith, MD, a virologist and chief of the Division of Infectious Diseases and Global Public Health at UC San Diego School of Medicine. It was only on the 3rd test, when they sampled fluid from a bronchial wash, that they were able to find the virus. Now think about what this means. We do the test 2 times, the guy tests negative, but that didn't convince us, all right? And this guy is like a very important person. He's head of infectious disease and global public health at UC San Diego Medical School. So he's influencing future doctors. This is great. This is a big problem, people. This is why all the talking heads on TV are lying to you every day. This is part of the problem. The article goes on to say that this isn't an isolated incident because there are limitations to current tests. Experts say they don't know how reliable they really are. According to the article, clinicians report false negative rates as high as 30%. The FDA issued an alert warning of false negatives with Abbott Labs' ID Now rapid test, which is one of the most commonly used. So we're using a bad test to diagnose the cases. If the test is negative, we assume they have it anyway, and then we forge the death certificates, and then people say, I can't believe you don't believe there's a pandemic going on, Pam. Really? All right, data and annals of internal medicine show that test accuracy depends upon when the person is tested, because the false negative results vary during the course of the disease. So for example, on the day symptoms appear, the false negative rate in this study was 38%. It dropped to 20% on the 3rd day and increased to 66% 2 weeks later. I mean, this is a pretty high error rate, right? According to Stephen Rawlings, MD and PhD, infectious disease fellow at UC San Diego Center for AIDS Research, one of the problems is there's nothing to compare the current tests to. He said, quote, to truly determine false negatives, you need a gold standard test, which is essentially as close to perfection as we can get, but there isn't one for coronavirus. Colin West, also MD, PhD at Mayo Clinic, says the studies that have looked at accuracy of tests that currently in use are filled with flaws. That's a quote. One of which is that the sensitivity estimates are based on testing people who the researchers already knew had COVID, which means there is significant bias. He says that without control groups of blinded testing, it's impossible to determine the magnitude of the inaccuracy. The results of an analysis of 5 studies that included 957 patients hasn't been peer-reviewed yet, but it shows that the certainty of the evidence was judged as very low due to the risk of bias, indirectness, and inconsistency issue. And the conclusion of the researchers was the collected evidence has several limitations, including risk of bias issues, high heterogeneity, and concerns about its applicability. So the bottom line is that we're taking people who test negative on multiple occasions and saying, by gosh, you got it, we're classifying you as COVID. Even when the test is used and it's right, it's wrong up to 66% of the time. So this is why I continue to say, we don't know how many cases there are. So when people say, well, what about this state that has this many cases and this many deaths? We don't know. We absolutely don't know because as these people said, these are not isolated incidents. All right, let's talk about some more misinformation. Playgrounds are closed because kids should not be close to each other, and they could spread the disease from playing on the equipment. Restaurants have been advertising contactless delivery. You know, the delivery person like throws the food on the porch and runs away so we don't have any contact with anybody. And then we have people, I've heard about people that are so afraid of touching something that they let groceries sit on the porch for a couple of days to air out before they dare go out and pick up the peanut butter jars and canned food. I mean, they're afraid if somebody infected touch the cans, they're going to get the disease. Store employees are wearing gloves all day, but unless they change them all the time, they're touching things. That's why I don't want to wear masks and gloves in here. I'm touching phones and files, and it's just ludicrous. You cannot avoid germs and viruses, people. This is ridiculous. I mean, anybody who went to medical school knows this, and I don't know that these people went to medical. I don't know where they went to medical school to get these crazy ideas. All right, so where did all this nonsense come from? It came from a March 26 statement from the Centers for Disease Control saying, quote, it may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. It may be possible. Well, governors and departments of health started telling people, don't touch anything, wear gloves, and all this panic and ridiculousness with people letting their groceries sit on the porch for 2 days. Well, after months of this nonsense, the CDC now says the virus doesn't spread easily, quote, from touching surfaces or objects, ends of quote. There wasn't any big announcement. There was just a change on the website. The guidelines, got picked up by some reporter who's actually doing his or her job and looking into it. They don't do that anymore. According to Dr. John White, Chief Medical Officer for WebMD, the CDC's changes are, quote, an important step in clarifying how the virus is spread, especially as we gain new information. May also help reduce anxiety and stress. I mean, the anxiety and stress that people have been induced to feel over nothing is inexcusable. And of course, we got to work on what we can do with these people to make sure that they don't get taken advantage of again. I mean, I'll tell you what concerns me, just as an aside. The people who believe all this nonsense out there, think about the telemarketers having a heyday with selling them stuff right now. If you're stupid enough to believe all this crap, I can't imagine what people could sell you. I imagine the folks calling them saying they represent the IRS and the utility companies and everything else, they're probably making a heyday now. People whipping out their credit cards and saying, oh, if you call me on the phone, it must be true, right? Well, anyway, the FDA actually made the first announcement about this, issuing a statement in mid-April saying that there was, quote, no need to wipe down food packages purchased at the grocery store. Now, the mainstream media doesn't report this, so people are still wearing gloves and paranoid about picking something up off the porch. And I ordered something. I'm trying to keep restaurants in business, so I'm eating out more than I ever have or ordering in. And now you can opt for contactless delivery, so you don't ever have to come in contact with the delivery person. It's just absolutely ridiculous. And then the grocery stores are dripping with this disinfectant, smelly crap. It gets all over your clothes. So I bring carts in from the parking lot, and somebody gave me a dirty look one day, and I said, I have a death wish. You caught me. I'm trying to kill myself with the grocery store cart. You got to have a little bit of fun with this, or you'll just go out of your mind. Now, to make your head hurt, I had already typed this up yesterday, and I saw a news feed that the CDC is now saying, maybe we were wrong. maybe it does last on surfaces. Apparently that gave people too much freedom. If it was resulting in maybe some people not being so neurotic, that's not good. When you're in the health business, like the Centers for Disease Control, the more panic you can incite in the population, the more successful you are, apparently. So anyway, all right, let's talk about some things that are coming next. This will warm your heart when I tell you about this. First of all, MIT, with funding from the Bill and Melinda Gates Foundation, has developed a method for delivering numerous vaccines to newborns over a period of time with just one injection. The technology involves a 3D fabrication technique called SEAL, which stands for Stamped Assembly of Polymer Layers. It uses three-dimensional microparticles, which can be filled with vaccines or other drugs, sealed and programmed to degrade and release the contents at specific times. According to Robert Langer with the David H. Cook Institute at MIT, quote, "We are very excited about this work because for the first time, we can create a library of tiny encased vaccine particles, each programmed to release at a precise, predictable time, so that people could potentially receive a single injection that in effect would have multiple boosters already built into it. This could have a significant impact on patients everywhere, especially in the developing world where patient compliance is particularly poor." So think about what a great idea this is. We're going to take the 100+ vaccines that a child is going to get, 87, 100, depending on where you live, but that they're supposed to get. We're going to stick it in when they're babies and just let that degrade over time and release vaccine into the bloodstream. Great idea. Now, this next thing will put a chill. It'll make your hair curl. Mine's already curled, so didn't have to worry about that, but yours might. So, CoviPass, it's spelled COVIPASS, was awarded the Seal of Excellence by the European Union. It's referred to as a secure to work protocol. And I took this right off their website. In order to safely return to work and social interactions, up-to-date and authenticated health information is vital. CoviPass is a secure, patented, and trusted solution that can successfully deliver on this objective. CoviPass is able to display past and current COVID-19 test results to confirm your immunoresponse. This ensures confident return to work and life. Now, I want you to think about this. Confident return to work and life. In other words, you need this in order to live. You need permission to live now from these people. So how it's validated, CoviPass connects your personal biometric ID plus your COVID-19 test result plus your unique V-code identifier in order to declare you, quote, health authenticated. Now here is how you become authenticated. An account is created, authenticated, and then the person is assigned a COVID-19 test kit using the kit's serial number. The test is administered and the results are uploaded. The healthcare professional will then set the trigger date for the individual being tested to come back for a follow-up test while the special measures are in place. This will trigger notifications in the app from 1 week before the next test date. So you get tested again and again and again and again. The CoviPass passport is then assigned to the user's V-code, which allows them authenticated access for return to work protocols. The V-code itself plays an amazing part when it comes to safe return to work and social reintegration, and is far superior to other technologies and solutions. So we're going to, if this is done, it is being done in Europe. What they would like to do is do it here, so we actually get permission from the government to socialize. We get permission from the government to live if we get authenticated properly. Over my dead body, never going to happen. The V-code can be scanned outside of the safe distancing zone of 2 meters as advised by governments and World Health Organization. This allows for safe, secure checks in a controlled environment while steadily allowing the public to resume their work and social activities. In other words, people authenticating, we have people that are being authenticated for the right to live and work while the people doing the authentication practice social distancing, so people can wander around in areas and detect if you are authenticated to be there. CoviPass is agnostic to any COVID-19 test brand or source and can integrate with all global COVID test manufacturers. Now we know the tests are inaccurate, so that warms your heart, yes? During this global COVID-19 pandemic, the world is searching for a secure solution to hold test immunoresponse information and vaccination details. For now and into the future, CoviPass has been developed to be the world's most secure digital health passport solution. Through unique biometric access, users are allowed access to their health and immunoresponse information. COVID Pass safely facilitates safe return to work and life. Again, this is allowing you to live on the planet, is what is really being said. COVID Pass is equipped with military-grade encryption and has more than 2.2 quintillion variations of codes, which securely corresponds to certified tests, all of which can do something different based on the details of the scanner, user ID, time and date, device type, and how many times they have been scanned. Welcome to the new world. Of course, I've mentioned before, we're going to get ready to welcome these people to an entirely new world soon. So that's what we have to look forward to. And I guess for the people who are staring at the news every night going, yep, we've got a pandemic. It's really terrible. I know the tests are accurate, the deaths are forged, but it's really terrible. I better wear my mask. People who don't wear their mask are bad people. I guess they'll just sign up and they'll get chipped and they'll get permission to live and think it's just swell. I don't know what to think about people like that, you know. I don't like to talk negatively about people in general, but it's hard not to talk about the people who are doing this to others in negative terms. I have no fond thoughts about Fauci, for sure. And it's hard to understand how somebody can actually take any of this seriously and ignore the bigger thing that's going on, which is the taking away of our rights in a major, major, major sort of way. All right, that's all for today. Pass this on to anybody who you think would enjoy watching it. And I'll be back to you tomorrow with more news.